It's interesting because when you watch people, and I like to watch interactions. It was interesting not only last night with a number of us that had dinner, but today, is that you saw new relationships being developed. You saw people getting to know each other better. Many people here knew of each other, but today you get to know each other more. And the more interaction that you have like this, the better it is. Because when you know, and you know people more than you did before, you begin to work together. So this conversation today obviously is the beginning of a conversation. What we would very much like to do, by the way, going forward is to stay in touch with you, but also focus in on a number of items coming from the discussion today. Let's say, for example, the caregiver issue. There are many people in the room working on the caregiver issue. So what would happen if we got that group of people together on an ongoing basis? The people who just focused on that issue, to work with us to figure out how do we work together, use the collective power of each of us, and as a collective to do more. I'll take those who are working just on primary care in the home, which was discussed by Eric earlier today, and it is highlighted and not in the book, by the way. What would happen if we got just those people together to figure out what new lessons can we learn from just doing that? So this is what we want to follow up on, because the power of relationships is very important. The power of getting people together is very important. This is the type of thing that we like to do. This is what I think all leaders should be doing more of. I think all healthcare leaders have to be looking at healthcare, not just what happens inside the walls of their organization, but what happens outside the walls of their organization that impact what goes on inside. As was said by a number of the speakers earlier this morning, a number of the panels, only 20% or up to 20% of health is dictated by medical care delivery, which we need to do very, very well and better than we do today. We need to continue to improve. But what we got to do on the upstream is what's going to make the huge difference. And on the aging issue, I believe that we got to begin with kids on the upstream, as on part of the upstream, so that we teach what it is like to have a healthy lifestyle, so that when you get later on, you have a better opportunity to be healthy. So these are the things we're going to be following up on. And I would urge everybody to be excited, to be positive. Positive attitude makes a huge, huge difference. When you look at things, it's not what you look at, somebody said. It's not what you look at that matters, it's what you see. And when we look forward, all of us, we can see a better future. We have to see a better future because the alternative is too depressing. And that's a positive attitude that we're going to be having for the next 4 years. And I'm not talking politics, but positive attitude during the next 4 years will be very, very important, because those of us who believe in doing what's right have to continue pushing to do what's right and not be confounded by political ideology, irrespective of your political persuasion, but constantly doing what's right. And so, that comes, I talked a little bit about this at another event a couple of weeks ago, that, we have and a little bit, because it is connected, obviously, to the issue of aging. Everything is all interconnected. I mean, we have to continue to build trust in science, because science is what makes discovery. We have to promote the positive aspects of vaccination. We have to continue to make sure that medical decisions should be between the physician, the family, and the individual. And that we provide all medical services irrespective of circumstance, and not be constrained by what other people ideologically think is wrong, because we believe it is wrong. Okay? Lots to do. And as we all age, we have a responsibility to those that come behind us to actually continue to promote values of decency, respect, integrity, trust, caring, those things that matter the most, to health, to positive lifestyle, to the idea of community, and to the idea of making tomorrow better than yesterday. And I'll just end with a quote that is from Mark Twain. Many of you may know this one, but it's something that I always often think about. It said, it says, 20 years from now, you will be more disappointed by what you didn't do than by what you did do. So throw off the bowlines, sail away from a safe harbor, catch the trade winds in your sail, discover, dream, explore, and do. So as we leave here, let's keep exploring and doing more. Thank you all so much.